Welcome, everyone. This is Shane from the International Hospital Federation. Thank you for joining us today for our webinar, Patient as a Partner, the Becquerel Lab Example. This webinar is being presented by Mikaël Daouphars, hospital pharmacist at Henri Becquerel Center, and his former patient, Emmanuelle Hoche. Just a few reminders before we proceed. All attendees will be on mute throughout the webinar. If you have any questions, you can type them in the Q&A tab. We'll try our best to go through all the questions after the presentation. The recording of the webinar will be available on the IHF website next week. We will send you the link to your email addresses. Now, it is my pleasure that I introduce our webinar presenters. Mikaël Daouphars joined the Henri Becquerel Center 13 years ago as a hospital pharmacist. He is president of the Hospital Medical Committee and responsible for the Becquerel Lab project group. He also works at the university as associate professor in clinical pharmacy. Emmanuelle Hoche, former breast cancer patient and caregiver, is researcher in psychology, consultant in human relationships, and coordinator of the Becquerel Lab group of patients and partners since September 2018. The respective functions and experiences enable them to work on this joint project. Mikaël and Emmanuelle, thank you very much for joining us today, and we are looking forward to your presentation.
Thank you, Shane, for this nice introduction. Hello to everyone. Either good morning or good evening, depending on your location. It's our pleasure to share our experience of the Becquerel Lab to implement a patient as a partner approach. First of all, my interest links, and Emmanuelle has no link to declare. So in which context does we implement this project? Our center is dedicated to cancer care, and for some years now we face a revolution with the arisal of P4 medicine that is predictive, preventive, personalized, and participatory. And this P4 medicine imply new trends and new organizational modes. With hospitals, we focused on a strong technical platform and concentration of expertise, and for sure a stronger integration with primary care, and also with new technologies with e-health, artificial intelligence, and big data in everyday life. We have also a new approach of participatory management of patients and caregivers. The French Federation of Comprehensive Cancer Centers has tried to identify some changes in hospital cancer care by 2025. And some of them are developed on this slide, such as increase of outpatient surgery, more targeted and less invasive radiotherapy, development of targeted therapies, immunotherapy, and oral therapies. And probably a change that we have seen is that we expected half of cancer patients to be treated by oral chemotherapy treatment only. But we see more and more combination therapy with oral chemotherapy and also IV immunotherapy. The fourth major change is tumor characterization with better understanding and adapted treatment, development of therapeutic interventional radiology, and for sure integration of supportive care in general oncology. All these changes are engaged in health system and patient outcomes. And regarding health system, as mentioned earlier, the rise of the primary care that is subject to a greater integration with secondary care. And for this, we have an increased role of health facility coordinator and organizer, which is a job that is usually done by nurses. We have an increased specialization of expert institutions and also organization of public institutions into networks. Regarding patient outcomes, we have more active patients in therapeutic decision-making. We have also patients who will try to be more involved in their care. And this is especially true with the implementation of PROMs that are patient-related outcome measures that were first introduced in clinical trials, but that we see more and more implemented on a daily practice. We have an increased weight of patient associations and patient initiatives, and also a larger population of cancer survivors. That is, of course, very good, very important, and can constitute the basis of recruitment for patients as partners. Our project is, of course, inspired by experiences abroad. So a partnership between patients and healthcare professionals has already been implemented in different countries, such as USA, Canada, and UK. And we provide below some examples, such as the work from University Hospitals of Montreal, Canada, the program from NHS England Patient and Public Voice Partners, and also linked to the King's Fund guide that is very interesting also to read should you have such a project in mind. Just some few words regarding the center Henri Becquerel. So it was founded in 1967. It's part of Unicancer Federation, that is the French Comprehensive Cancer Centers Federation. And it's based in Rouen, that is in Normandy, France. And our center is just located nearby the University Hospital and the Medicine and Pharmacy universities. Our center serves a population of around 2 million inhabitants in a region that is the second most affected region of France by cancer. So this is a very important, or these are very important diseases we deal with. So what was the hospital willingness in the Becquerel Lab implementation? It was to promote a new relational model based on partnership and complementarity between external resource persons, such as patients, caregivers, users, civil society, and healthcare professionals. So we decided to implement an innovative approach inspired by the Anglo-Saxon countries, whose objective is to have a significant impact on the quality of care in the hospital. But it was also to respond to new challenges, such as attractiveness, requirements for certifications, and also to strengthen links with the patients and caregivers. So which method did we use? To consider the user as an unavoidable partner in all decisions that concern him, to rely on his expertise that was acquired through experience. We set up an operational group of volunteer patient resources to build an incubator lab for ideas, forum for debates, proposals, positive criticism, and construction. We identified some keys for improvements on specific teams, and this was to be done for sure along with healthcare professionals. We proposed to delegate the coordination of the group to Emmanuelle. Emmanuelle has, as she will show you later, many competencies. First of all, it was important for us that she's a former patient, so she's an expert patient also, and caregiver. And this gives her the legitimacy to coordinate a group of patients and caregivers. But also in a professional life, she is a project management consultant and a psychology researcher. And as such, she has also professional competencies to coordinate the group. And this approach was inspired by that of the Rose magazine journalist. So Rose is pink color in English, and this is a magazine where journalists are former patients, and this magazine is for breast cancer patients. Which themes did we identify? For sure, current and future care pathways. We have also a new building project that is called Becquerel 2025, which is a big project of building dedicated to prevention and ambulatory care. We identified also disease and relapse announcements, patient information, the place for the caregiver, treatments of all kinds, complementary and alternative medicines, consequences of the disease, of the treatments, reception, confidentiality, waiting time, comfort, access, appointments, signage, and so on and so on. And of course, care coordination and cancer survivorship. So which patient profile did we search for? We asked healthcare teams to identify some patients and some caregivers for the richness of their care experience, their ability to express themselves, to identify their needs, and to sit on a committee with objectivity. They should be able to be motivated to share their vision of any dysfunction or gap they may have identified, and to commit to improving services and programs. For sure, and maybe we may discuss this a bit later during the questions period, but these patients should not be in an acute care episode in order to take the necessary distance during the working group. Along with the global Becquerel Lab project, we have a digital part that is linked to a digital health challenge to monitor patients undergoing oral chemotherapy at home. And this digital project includes use of IoT devices such as a connected pill dispenser and other IoTs. And this digital part is in connection with the creation of a living lab that is hosted by the Normandy Region Digital Competitiveness Cluster. And as the global Becquerel Lab project, the idea is to have the patients, caregivers, healthcare professionals, digital companies, and digital research teams working all together. And finally, we have a third part of the Becquerel Lab project that is dedicated to youth and young adults with specific themes on the pathway of young people. So we created a group of young patients with parents and siblings. And this youth council is a space for exchanges and debates, and that is really dedicated to their own needs. And for this part, we were inspired by the Children's Council that is set up in 2016 in the pediatric ward of Gustave Roussy Comprehensive Cancer Center in Paris. So in terms of calendar, this project started last year in January with the project writing, validation by governance bodies, information of all stakeholders, also search for funding. And then during spring, we started the project with analysis and validation by the project group, definition of themes, elaboration of supports, planning of a project, and also started the patient's recruitment with interviews by Emmanuelle. After summer holidays, we started the pilot phase of 6 months that was reconducted afterwards with a launch party, the start of patients meeting, and also still interviews by Emmanuelle, as she will show you later. At the end of last year, and for sure continuing this year, first restitutions, putting decisions into actions, and also adapting the model as far as we are working with patients and healthcare professionals. So time now for Emmanuelle to give you more details on the lab.
Okay. So hello everybody. Well, good morning, good afternoon, good evening, depending. Before continuing our presentation, and as I have something to ask you, I just want to tell you a short true story. Once I was having a discussion with my surgeon, and I won't tell you what we were talking about, but she said to me, you have to watch the series How I Met Your Mother, because it's very funny and it's unescapable. So as I am a model patient, I said, okay, I will, without understanding, of course. And then I learned that I had to make this webinar in English. The problem is that in my job, neither in my life, I don't speak English very often. So I had to improve my English. That's why I decided to watch this series, How I Met Your Mother, in English. So if I forget some technical words, please, it's not my fault. It's just because the words are not in the series. So just be indulgent with my English level. Thank you very much. So now we can talk a little about the project, and first about the recruitment of the patient partners. The first step was to define who we are looking for who we were looking for. As seen previously with Mikaël, profile of patient partners are very specific and strict. Many qualities are required. I just repeat: ability to express themselves, to identify their needs, and to sit on a committee with objectivity. Motivation to share their experience, their ideas, to find solutions each time it is necessary. To reach this goal, we decided to take into account more criteria. So we included various types of cancer, so that it implies different pathways. We wanted also men and women, because we have more breast cancer, and it's harder to recruit men. But we wanted also, and also various professionals profiles, like engineer, teacher, computer specialist, retiree, social worker. We've got also a cooker, etc. To complete the group of 9 patients, we have integrated 2 caregivers. a first and unique caregiver and a secondary caregiver. Both have an experience with the Center Henri Becquerel. As I am the secondary caregiver, I can also have a double experience, which allows me to give 2 points of view. Finally, candidates who did not integrate the group have the opportunity to integrate a 2.0 group. If they accept, they can be requested by mail to test online tools, to answer surveys, to express their opinion on documents produced by the center before distribution to patients. For example, brochures, videos, leaflets, and so on. This 2.0 group is also a way to recruit new patient partners for the Becquerel Lab if some decide to quit the group or have to. For example, if they are ill again, they have to quit the group. For the moment, everybody is okay. The second step is how to find the profile. So as Mikaël said, we use different networks, and first we asked health personnels to identify some patients who could fit the profile. Then we posted a message on the Facebook page of the Center Henri Becquerel, and then the coordinator, so I, also recruited in the sports health group of which I was a member, and in my personal and professional network. Then I conducted interviews, like job interviews, with the same requirement. It was very important that, that the members really fit the profile defined with the center. So as the group is complete, we organize with the center a launch party with all patients and professionals of the Center Henri Becquerel who take part in the project as reference. I made a short introduction, and then we had free exchanges between participants of the lunch. The main interest of this party is to show that health staff and patients are first of all humans that can work together to be stronger by improving communication between them. The theme of the first meeting of the group was the presentation of the building project called Becquerel 2025. For this first meeting, we mobilized the head of the building project, whose name is Damien Neuville, to explain first the project, then to answer the questions that the group may have, and then to collect the first suggestions. For example, the improvement of the organization of the parking lot, explanation of the difficulties for patients, and discussions to find solutions. What I can say is that in the Becquerel Center, there are a lot of difficulties with the parking, for example, to find a place to park for patients and caregivers, but also to drop off without any ambulance. So it's a real big problem, and we had to discuss about this. Then a first thing for the patients is that all the group want a sport hall for health staff, which was unplanned.
At the moment.
At the moment. So we gave arguments and had discussions to find a site for this place. The following meetings, we are concentrating on the outpatient surgery. So we noted that there are still different points of view between patients and staff, and also between patients. A French study revealed that 32% of the patients prefer to stay in the hospital as they feel more secured. So we started a discussion on what can be done, what we can do to contribute to the development of the outpatient surgery. So we proposed a few ideas. Patient information sessions, as for the debates on breast cancer or hematology already organized by the Center Henri Becquerel. Promotional videos or slides to be broadcasted on screens within the center. A brochure or a leaflet to explain the interests of the ambulatory care. An additional page on the website to talk about the benefits of the ambulatory care. And also we would like patient testimonials on the media. What we can say about this testimonial is that if they are controlled by the center, by the professional of the center, I think these testimonials will be helpful and not scary, because sometimes you can find testimonials on the internet, on the net, but they are more scary than than helpful. So that's why we have to choose the testimonials carefully. Yeah, that's it. Thank you. Another mission of the Becquerel Lab is to help the center to develop its network with the different actors nearby, companies, communities, region, and so on, so that it becomes more and more well-known and possibly increase supports, financial, materials, relation, and so on. To reach this goal, some member of the group and I share our professional networks, respond to media solicitations or organizations like the French Federation Uni-Cancer or, for example, the IHF. The group also participates to the organization of a local debate for a major national debate. So let me give you some more explanation of that. The French president, Mr. Emmanuel Macron, organized a major national debate to give the opportunity to the French people to give their opinion on several subjects. For example, environment, employment market, and so on. The health minister of France said that every local initiative was welcome. So the Henri Becquerel Center and the Becquerel Lab decided to organize this local debate on health issues. Three themes were discussed: access to cancer care and innovation, prevention of cancer, and patient as a partner. 56 persons worked in 3 groups, and the results of the discussions were then sent to the government via an online platform. In parallel with the meetings, patient partners can be requested to give their opinion on various documents. For example, a charter of commitment of the center to improve its reputation and image through working methods, development of the research, and its capacity of innovation. Another example is brochures and leaflets, how they are perceived, how they can be improved to be more efficient and relevant. And then the website, how it is used, and what the patients expect from it. To complete the mission, I lead several interviews with health professionals to prepare the patient partners meeting, work groups. Those appointments with health professionals aim to help the group to take into account the constraints of the various jobs and of the organization. Some of them can be invited each time it is necessary during the various meetings to give more explanation on specific points, for example. Another aim is that these interviews are also used to start collaborative building between patients and health staff. They should help to build a new relation model as we discuss our respective expectations. A feedback from experience, what works and what is still difficult. So at the moment, what works is the open-mindedness of the health professionals involved in the project, the motivation of the group of patient partners, and then the quantity of subjects, because it's very interesting. But there is 2 points still difficult at the moment for the project. Is to answer the many solicitations which take a lot of time, because I have my company and other customers, but I try because it's very interesting anyway. And to schedule the meetings with a complete group, as most of the patient partners have a job and are now back to work. Regarding the perspective, several terms still need to be further developed by the patient partners. Among them, supportive care, how to improve therapeutic education programs, how patients partner could help to develop more adapted and relevant contents. Consideration must be made to find emerging ideas to build training programs for patients and for health professionals. And then how to enhance relations between patient association and the Henri Becquerel Center. And we have a lot of more subjects to be continued.
Just a few words to say that to start this project, we got support from different companies, so it's the opportunity to thank them for their support. And of course, you will find on IHF website our contact details, but you have them also on this last slide. Thank you everyone for your audience.
Thank you very much.
And well, we're still there for some questions and comments on this project.
Thank you, Mikaël and Emmanuelle. We'll start reading some questions from the audience shortly. Just to remind everyone that you can send your questions by typing them in the Q&A tab. So here is our first question. Do you have any consideration regarding the sustainability of this experience on the long term?
Well, I think it's as Emmanuelle mentioned before, we have many subjects, many topics on the desk, and this means that we should be cautious to be able to maintain the energy within the group, and to adapt to patients' agendas, to organize the meetings. And we see that after the first beginning of the project, we need to build something that is more sustainable, and probably we may be inspired by documents like the King's Fund or so, who try to structure the project on a more stable basis.
Okay. The next question we have is, do you expect any pitfall in the coming years?
Any pitfall? Difficulté.
Ah.
C'est ce qu'on avait dit.
Yes. Yes, or of course there will have some for example, the main difficulty probably will be to maintain the group or to recruit new persons, new members, and work always together with. It's not so easy when you make a group to introduce a new person regularly, and that's one of the difficulties we should have.
Okay.
I just see from questions from the audience, some of you is asking about supportive care definition. Supportive care are all the treatments that will go along the treatments for treating the cancer. I mean that we know that cancer treatments have different toxicities, for example, especially chemotherapy. And supportive care treatments are there to accompany the patients with these toxicities. But this is a very wide area, because in supportive care, you have also dietitians, psychologists, physiotherapists, sports, mindfulness, meditation. All these approaches will help the patients as a human being to feel well during the treatment phase. If it's clearer now.
May I say something?
Yeah.
The supportive care in the Center Henri Becquerel are really developed and very important for our patients. For example, we have also messages. Can say that. We can make. We can play tennis. We can walk with coaches, especially. For me.
Training.
Training. So it's very important and very big. So sometimes we have to, well, not sometimes, but we will have to discuss about this subject too.
One of the questions is, are the patients issued from coming from patient associations or not?
No, we didn't, because we think that it can be hard to be in the group and in another association. But we will work with patient associations when we will work on this theme. How can we improve or enhance the coordination between patient associations and the center?
Another question is, how many patients did you interview to get 9?
Yeah, our interview less than candidates, but I would say about 20. About 20. Yeah, if I remember.
We still have a number of questions. Yeah, we still have a number of questions from the audience. Which evaluation of this experience do you expect to implement?
Well, evaluation of such a project is not so easy. Well, because the more we go in the project, the more we can approach difficult questions. So you have seen that first, the proposals, the themes were not so difficult matters, and then we go in terms of complexity. So I think it will be important to evaluate at least the patient partner's satisfaction.
Yeah.
And also healthcare professional, and probably to then progressively see what we have been able to propose or to change in both healthcare professional and patient lives. Probably first of all patient's life, but probably you have.
Yeah, for the moment it's not so easy to evaluate because it's not quantitatively or qualitatively. We are. I would say we are learning how to improve the group. We are studying for the moment because it's a very new project for us, and we have to. Yes, we have to improve, and then what we can see is when we give ideas to the center, what the center do with these ideas, and when they decided to apply that what we said or what we propose, we said, okay, that's good job. We worked well in the group, but yeah, and together that's an indicator of the quality of the evaluation of the quality.
Okay, here's our next question. Did you have any concern related to funding by pharmaceutical companies?
Oh, yeah, good question. Well, for sure, we decided, well, it was very important for us to be able to fund the project, especially if you are considering all the work that is done by Emmanuelle, and trust me, this is big work. It was very important for us to reward Emmanuelle on a professional basis for this work. So as such, we needed funds. So for sure, we asked first some private companies. We decided to ask different companies to have diversity and as such a form of neutrality. For sure, we would be very pleased if we could be able to get in the future also public funding. But we must admit that in France, at least, such experiences are just starting, very few of them. And as such, these pilot phase are not funded at all by public funds. So we still rely on private funding at the moment. But for sure, we don't have any private companies don't have access to any of the group discussions because these are really private discussions between the patients and also between the patients and healthcare professionals.
Just we are working also for public funds, perhaps, but for the moment, not yet.
Okay, we have our next question. Does this work involve patients with advanced illnesses and their carers? If so, what methods have worked best for this group?
Est-ce qu'on a des patients avec une maladie avancée?
Dans le groupe?
Ouais.
No, not at all. That is one of the criteria. We cannot include patients that are too ill.
Well, yes,
that are too ill.
Advanced disease.
Advanced disease, yeah. We cannot include because it could be too difficult for them to talk about cancer, to take enough. To have enough reflection and to have the good distance with cancer if they are too ill. So that's a criteria very important for us.
Yeah, and probably also that we consider that fighting such a disease when you have an advanced disease needs much energy, and patients should focus on their care rather than other work. We have a questions that is maybe Shane, I take the opportunity to read the questions on the screen. In France, we have patients representatives at the hospital governance. How do we interact with them?
At the moment, we don't have any interaction. We have to wait a little bit because we want to work first on the ambulatory care. But then when we will work on the coordination or the work between patient partners and patients represented in the center, we will contact them and discuss about how we can improve the work and how we can work with them.
However, we presented the project to these representatives, and we got a positive feedback from them to start the project. So it is important for us to have a link between the Becquerel Lab and the patient representatives, but we do think that the respective work is different between the two groups.
Okay, so I still have a number of questions here. Was it easy to get the health professionals involved, and how did you get them engaged?
I spent a lot of money. No, objectively, it was not so difficult. First, when we presented the project, some of them were at the meeting and were already interested, and they said to me, okay, if you need help, I am ready to contribute, and just ask me. That's one thing. Then I asked my professionals, my health professionals, well, my surgeon, my oncologist, the secretary of one of my doctors, etc., and the people who I met in the center. I talked to them, talk about the project, and really it was not difficult to get them interested.
For sure, the project has to be presented to the hospital governance and the different committees, with the professionals being there. Some of them may need more detailed explanations on the way how patients and healthcare professionals will work together, but we did not face any objection for their participation.
Yeah, exactly what Mikaël said.
Noticed.
Yeah, I noticed during the interview that some of them were a little bit afraid, perhaps, but I talked to them, explained the project with more precision, and it was okay.
Our last question for today: how many of the proposed ideas were implemented? These ideas required more process improvement or heavy investment?
Well, how many we are not at the step where we are quantifying all the ideas and seeing if all have been translated in the hospital or not. already some of them have been accepted, so this is a good point. Even the sports hall has been accepted by principals, so it's a
big
good
one.
news. But yeah, for sure we see that maybe some proposals will need further discussion, probably more reflection on processes or even investments. So these are still on the desk, but for sure this is also part of the way we are going to follow the project. Will be that we will check regularly what was done with the ideas and the proposals from the group, and for sure this is mandatory that the group feel that the proposals are taken in full consideration by the center if we want that the project goes working.
Yeah, for example, we worked on 6 or 7 documents, leaflets, brochures, and presentations, and most of what we noticed was modified by the communication department of the center. So that's good. The sports hall, the sports hall, and then all the subjects we are actually working on. Well, we still don't know for the moment.
Okay, thank you to everyone who sent in their questions. If you think of any additional questions later on, you can contact Mikaël and Emmanuelle through the details displayed on your screen. Mikaël and Emmanuelle, is there anything else you want to say before we end our webinar?
Well, just thank you for your audience. It was a pleasure to share our experience with all of you. And again, along with Shane, please do not hesitate to contact us should you have any question.
Yeah, thank you very much.
Thank you once again, and thanks to everyone who joined us today. We will be posting the video recording on our website next week, and you will receive the link in your email. Also, we have a very quick survey which will be displayed on your screens right after the webinar. We'd greatly appreciate it if you can provide your feedback. We hope you can join us again in our future webinars. Next month, we have a webinar with Dr. Mark Gebers, Director General of Zorgnet Icoro from Belgium. He will be talking about incentives from the authorities on quality improvement in Belgium. We'll send more information about that shortly. Thanks again, everybody, and I hope you all have a great morning, afternoon, and evening ahead of you. Bye.
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 Bye.